Occupational therapy at Orthopedic Associates of Michigan is primarily the treatment of upper extremity injuries, from rotator cuffs injuries to anything shoulder related, elbow related, wrist on down to hand and fingertip injuries. Occupational therapy focuses on the individual's needs, and sometimes what's important to one individual is not important to another. An example is somebody with arthritis. They have sort of a limited span of functional use of their hands without it being very painful. So we talk to them about what their needs are. If that individual's focus in life is to be able to play the piano, we'll look at ways to help them play the piano, but then other ways to conserve their energy. So it might be adaptive equipment to help cook and clean, things that aren't as important to them. On-site occupational therapy services is part of our work center division, and what the primary goal of that is, as you truly look at occupational therapy, is to look at their surroundings in an actual setting. So we may use job simulation in their environment. We may watch what they do to make recommendations for either equipment modification or process improvement. So our goal in that is to, in their own environment, find a safer, more efficient way to do their job. Working with children is not uncommon. Working with somebody in an elderly bracket is not uncommon. So in any given point in the clinic, you will see probably someone of every age being treated for something vastly different. We have 4 offices throughout West Michigan. The primary office for upper extremity hand therapy, occupational therapy, is our Leffingwell office, the corner of Leffingwell and Leonard. Our secondary office is on Michigan Street in the Musculoskeletal Center adjacent to Butterworth Hospital. Our next office would be at the South Health Pavilion, which is in Cutlerville on 68th and Division. And then our most recent clinic is in Greenville, across the street from United Memorial Hospital.